I'm going to be going through stages of recovery whereby there's going to be 5 different stages that you will go through after having a stroke for your hand and your wrist, okay? And in this video, I'm going to be focusing on stage 1 to 3, and in the next part 2 of this video, I'm going to be focusing on stage 4 and stage 5. So just a quick explanation of stages 1 to 5. Stage 1 is where it's right after the stroke, and this is where we call this the flaccid or the weakness stage. This is where your hands are going to be very limp. That means you can't even lift up your hand, and most of the time when you are hanging, it is just going to be like this, okay? There's little power here, and you'll be very frustrated when you want to move your arm. It's just not moving and listening to you at all. So this is what we call the stage of flaccidity or severe weakness, and this is most often going to be present right after the stroke. Sometimes for some of you it may be actually lasting for much more longer, but most of the cases this is just the stage 1 in the early stages of your stroke recovery. Next is stage 2. Stage 2 is where you start to feel there's some tightness and some tone coming in, and this is what we call the early spasticity stage. So at this stage, you still may not have any voluntary or active movement in the hand, but you can notice things like whenever you're like yawning or whenever you're standing, you start to notice your hand and your wrist start to curl up a little bit more. But it's actually not that you are curling it up, it's just that the tone is, or the spasticity that is there, and also because of the tightness of the muscles, these are movements that are generating when you are doing other activities. So there's a little bit of tightness, and this is at stage 2. Now stage 3, this is where tightness or spasticity is at the peak. Okay, so at this stage, tightness is going to be a major problem for you, and most of the time you may not be able to straighten up your arm at all because the muscles are just going to be very overactively tight, and this is the spasticity stage. And this stage is where some of you may need some medications such as oral medications to calm down the spasticity, or even Botox injections. And next is at stage 4. This is where the spasticity is reducing, and there's also a little bit of an active movement coming back. That means you are able to move your fingers and your hands a little bit more, but not much, okay? That means there's going to be flickers of movement, but it's not going to be like complete range of motion movements. And then we're going on to stage 5. This is where your power is coming back much more, and your tightness is also reducing. And this stage is where you can actually start to incorporate your hand actively for using daily functions, and also you can do a lot more strengthening exercises at stage 5. So like I mentioned, I'll be going through stage 1 to 3 in this video, and stage 4 and 5, the exercises I'll be showing you in the part 2 of this video. Welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. Quick disclaimer, I do this in my personal capacity, and this does not replace medical professional advice. So in stage 1, this is where you're flaccid and there's no power at all, severe weakness. The aim at this stage, right, is actually to maintain your wrist and finger mobility, and also help to provide some sensory input to prevent any contractures for the hand and the wrist, okay? So how do you want to do all this? Is you want to focus on passive range of motion exercises. So passive range of motion exercise, I'm going to show you a few different variations here. We're going to start off with the wrist, okay? So the wrist part here, we're going to focus on the up and down, so the extension and the flexion. Okay, so because it's going to be so weak, right, you want to rest your arm on a table like this with a towel on top of the table, and what you want to do is, using a stronger hand, you can actually start to grip your hand and just move it into passively going into extension. So you will have to bring your wrist up, and then also have to bring it back down because you do not have power to come back down, right? So you just want to use your thumb and your fingers to push it up gently and come down. So push it out gently and come down. Okay, so this is the extension. You might be familiar with this exercise if you have seen my other videos. And then the following exercise is going to be your flexion, so it's the downward movement for your wrist. Okay, so for this you can get your hand in a gripped up position like this, and just coming down and up. Okay, if you find that it's difficult to actually do it on a tabletop, then you may actually want to put like a plastic sheet, even on the towel. If you find that the friction is too much, you can actually put like a plastic sheet on top, and then do it with less friction. Okay, so flexion is like this and this way. So you're trying to bend using a stronger hand, you're going to bend this portion of your wrist here so that it actually bends down. Okay, so come down and up. Okay, down and up. Essentially what you're doing in this stage is actually just helping to maintain the range of motion that's available in each of these joints for your wrist and your fingers. Okay. So now going further up your hand into your fingers, what you want to do now is actually to grab each of these fingers to actually do a little bit more of a curling flexion movement and then extending it. Okay, so go ahead and grab. You can start off with either your thumb, or you can actually start off with your last finger first. Okay, so you just want to bend it this way. So you want to bend it in and relax, bend it in and relax. Make sure that as you're bending, you're not just bending at one joint, because there's a few different joints here in your fingers. So you want to make sure that all of it is actually curling up and straightening out. So curling up and straightening out. So do it for each of these other fingers. Curl it up and straighten it up. Okay, and then for your middle finger, okay, you can grab the entire head of the finger here and then just move it in and out. And same thing for your index finger. Okay, so this is something that you can do for your fingers. Okay, and in this position also, you can give a little bit of a pressure for your hand. Okay, so you just open up your palms like this and just using a strong hand to really give a bit of a pressure input. Okay, all of this is actually just giving you some sensation, hopefully to get some nerves that is may be functioning or may not be functioning yet, but all of this is just to give some input towards your brain to see whether some of these parts can start to wake up. Okay, you may not feel much, you may not feel anything, but that's fine. Just continue to do these exercises, especially if you're in the early stages of stroke recovery, because all of this is actually to prevent the joint from getting stiff. And once your joint gets stiff, right, it's going to be much more harder in the later stages. So you're actually doing the groundwork now to prevent all of these complications from worsening in the future. So the next thing that we're going to focus on is for your thumb. Okay, so thumb, there's going to be a few different movements. One of it is coming out like this, okay, and one of it is going backwards like this and forward like this. Okay, so take a look at the hand again. Okay, one of it is coming outwards and then going backwards and going forward like this. Okay, forward like this. So you're going to go with the up first. Okay, what I want you to do is just using your hand, you can actually use your palm of a stronger hand to do like a grip for your thumb like this, and just bend it up like this and down. Okay, alternatively, what you can do is you can grab the top portion of your thumb like this and then just bend it down and out and down and out. Okay, so you want to keep your hand in your forearm in a position like this, whereby your thumb is pointing upwards, so that it's easier to access your thumb. Okay, so back and forward like this. Okay, so a few different ways to do that. Next is you just want to gently bend it backwards like this. You don't need to force your thumb to go all the way, just bend it backwards gently and forward, backward and forward. And the next one is forward. Okay, forward, down and back, forward, down and back. Okay, so this is the movement that you're doing, because my arm might be blocking you from seeing it properly. Okay, so the final thing that you want to focus on for your wrist and your hand and your fingers for this stage where it's going to be completely weak is you want to engage this part of your hand. You want to do some massage over this area gently, very gently. And what you want to also expose this area to is different type of textures. Okay, so for example, I have the towel here. What you can do is you can actually get a towel to just brush along this, okay, to get a feeling of this type of a sensation. Okay, another thing that you can do is you can actually use like a comb and also just gently scrape it forward and back. Okay, just doing some brushing along this hand and even upwards all the way. Okay, and most of the time at this stage, what you're going to notice is that the fingers and the wrist is going to be a bit swollen, and this is very common, especially when it's very weak. So most of the time what you want to do is to keep your hand in a more elevated position like this. So for example, you can actually put a pillow, but I'm just going to show you with a towel here. You can just roll it up like this and put your fingers and your hand like this. Okay, so ideally it is a little bit more higher, more elevated, so that the fluids can actually flow backwards this way. So this swelling is actually quite common, so elevation is one of the simplest way to actually reduce it from getting worse. So for stage 1, all this passive range of exercises, this kind of repetitions, you want to do for about 10 to 15 repetitions, 3 sets, and you want to try doing it for about twice a day. If you find this video useful, do consider liking and subscribing and signing up to my weekly rehab recovery newsletter. Now coming to stage 2, this is where your fingers or your hand and your wrist, there will be some mild tightness that's coming, and you may notice that whenever you're like yawning, your fingers may start to curl up, but this curling up is not due to actively moving it. Okay, it's actually because of the spasticity or tone that is starting to develop in this hand, and this is causing you to have a little bit more of a flexion type of a movement in your fingers and your hand. So in this stage, what we want to aim is actually to begin to do some range of motion exercises with a little bit more of an active element, and you want to keep these joints in a much more stretched out position. So we're going to start with some gentle stretching in this stage, okay? So we're going to start off with the wrist extension first, okay? So what we're going to do is we are going to go backwards like this. So in stage 1, we actually did a passive range of motion. In this stage, what we're going to do is we're going to go to the end of the range and hold it there. Okay, we're going to hold it there for a while. Okay, so you can also incorporate like a finger stretch to this. So as you're going this way, what you can do is just slide your stronger hand upwards like this and bend it backwards like this. Okay, so this is to incorporate a little bit of a stretch. Okay, so when you have some mild tightness, you want to hold this stretch for about 15 seconds to 20 seconds, and you want to repeat it for minimum of 3 times. Maximum you can do as many as you can comfortably do. Okay, and there's no pain when you're doing this. So this is the wrist extension stretch along with your fingers also. You can do a stretch like this. You can put the thumb aside for now. Later on you can actually focus on the thumb separately and coming back down. Okay, next we're going to go into the stretching part for your fingers. Okay, so what's going to happen in this stage is that you want to bring your fingers out into your forearm into a position like this, and in this stage what you want to do is you want to actually grab each of this finger like this and just bend it backwards as much as you can. You don't need to yank it all the way up this way, okay? As much as you can, where you start to feel a little bit more of a resistance to the motion, then you stop there and you hold it for about 15 to 20 seconds. Okay, so for each of these fingers, you want to straighten out. So when you're bending it backwards, try to keep all these joints straight. Okay, so you're bending it backwards and holding for 15 seconds, and then the next finger, okay, hold it for 15 seconds, and then your ring, and finally your pinky finger. Okay, so if you want to do a different method, you can actually put your hand flat. If you can get your hand fingers and your hand flat on the table like this, then same thing, just grab the tip of your finger and just bring it backwards like this. Okay, holding it for about 15 to 20 seconds and doing it for as many times as you can comfortably and within the pain-free range. Okay, so now we are going to the thumb. Okay, so thumb, what I want you to do now is grab your entire thumb like this, your stronger hand, and pull it back gently. Okay, so pull it back gently. You'll start to feel a bit of a stretching over this area. Okay, then that's where you are actually doing it correctly. And when you're doing this, just hold it for about 15 to 20 seconds, same like the other stretches. Okay, so thumb, we are going this way, and after that we are going to go downwards like this also. Okay, so just going downwards like this. Okay, another 15 seconds. Then come back up, and you want to try to go backwards now. So the thumb stretches might be a little bit more challenging at this stage, so be careful when you're doing this. Do not really push past the pain. As for all these stretching exercises, do not push past the pain. So similar to stage 1, in stage 2, you want to make sure that you really get your hand into a resting position properly, more for the prevention of this tightness from getting worse. So towel here, you can actually put this towel when you're seated down on your lap also. You can put some pillows, but main thing, you want to get this roll of towel to actually contour along the lines or along the fingers and your wrist and your palm. Okay, so just so that it is not going to be left hanging, where if it's just left hanging, most of the time it's just going to tighten up further because there's nothing blocking it from tightening up. So it's just going to tighten up further, and over time the muscles will become much more tighter and more difficult for you to handle. So keeping it in a position like this, in a neutral position like this, a little bit more extended, yes, not really neutral, it will actually help you to prevent worsening of this tightness. So for stage 3, this is where tightness is at the peak. So most of the time your fingers and your hand might be in a position like this. So this is where you really want to focus on prolonged stretching and really weight bearing through the stretch. Okay, so when you are in this position, you want to get your forearm rested on the table like this, and you want to lean into your arm a little bit more. Okay, sometimes leaning into your arm, putting weight through these joints that is having a lot of tightness may start to relax it a little bit more. For some cases it might help, for some cases it may not help. So just give it a try and see. So in this position, what I want you to do is just do some gentle stroking movement like this, just like a gentle massage. Okay, so your forearm, and you can also do a bit of like a cupping motion like this. Okay, coming all the way to your wrists and your thumbs and your fingers. Okay, just do this for about 2 minutes first before starting out the exercises. So the main thing that we're going to focus on for this, because it's going to be focusing on your wrist and hand, we're going to focus on stretching your wrist backwards like this for a prolonged period of time, but we're going to use a little bit of help from your legs also, okay? So you'll understand what I'm going to say in a while. So once you have done this, try your best now to turn out your hand and bend it back up and putting it like this, okay? Your fingers may not need to open up straight away, but if you are able to get your hand into a position like this, then you can do these exercises. If you are still struggling, then I'm going to link a video in the top right hand corner. Take a look at that video to stretch out and then come to this video and try it out again. So if you're able to get your hand in a position like this, putting your forearm flat and your wrist in a manner that is a bit more neutral, then I want you to focus then on taking out this thumb, okay, and putting it aside and trying your best to open up the fingers as much as you can. So the main thing that you want to focus on is your wrist being in this position, not really your fingers and your thumb, okay? So once you are in this position, this is where you're going to use your legs, okay, to actually stand up a little bit more and put more weight on this side, okay, and come down. Okay, so as you're doing this, you can actually use your stronger hand to actually block your wrist here. Okay, so be very mindful that you are doing all of this in a pain-free manner, okay? So if you're having a lot of pain when you're doing this, then I'm afraid this is going to be too, you're not suitable to do this exercise yet, okay? So just stand out a little bit and put some weight and come back down. So after doing this for a while, you may start to notice that your fingers and your thumb is a bit more relaxed, a little bit more looser, and you may actually focus on stretching it out a little bit more before going on further with standing, because standing is going to be quite tiring. So you may probably be able to do it for like 5 times before you get tired and you need to rest. So whenever you are resting and sitting down, then you can focus on your fingers and your thumb by just pulling them out and keeping them in a position like this. So after you've done a few repetitions of a half stand, next we're going to get you to actually go into a full standing position. And what is going to happen is you're going to put this hand here so as to get a prolonged weight-bearing wrist extension stretch. So as you're standing up, I just want you to stand up as much as you can normally. And if you find that your wrist is lifting off, right, you want to use a stronger hand to place it, put some pressure over this area here to keep it in place, okay, as you're going up into a manner like this. So in this position, you can actually lean forward slightly, or you can actually grade it and see how much you can tolerate, and you can actually just hold the stretch there for a minute or 2. Okay, this stretch is going to be a little bit more advanced because you need to be able to stand up. So if you are not able to do this, then it's okay. Focus on the other exercises first. Okay, but if you are able to do this, then what you can do is also actually you can shift your weight from side to side, from putting more weight on the hand to easing off and coming to your stronger side, and going in to put the weight on the weaker hand to stretch it out and coming. So you may actually not be able to straighten out your fingers, that's fine. Get it as much as possible to be straight. Even if it's curling up like this is okay. Okay, so just be able to grade. So you can lean backwards, so to grade this wrist extension, and coming forward, you can see that you can actually get a bit more of a deeper stretch as you're coming forward. So once you have done all these stretches, you may start to notice that your hand is a little bit more looser compared to when you started. So in this, when you're done with your stretches, the crucial thing to do is actually to keep it in a prolonged stretching manner for as long as you can. So most of the time, if you just leave your hand like this, it's going to start to curl up. So this is where you can actually put like a small weight. You can put like a dry item product, or you can actually put some ankle weights over your wrist and your fingers, okay? So just gently, okay? So just putting it over here. But when you're doing this, be very mindful of the texture of this product, because if it's going to be very rough and very sharp, then it's going to, with prolonged exposure to your skin, it's going to cause some damage. So in any case, just put it on for about 2 minutes and observe how your skin is reacting, and slowly increase the duration for as long as you can tolerate. And also be very mindful that the weight is something that you have to gradually increase. You cannot just put a 5 kg weight at the start, because this may cause some damage to your joints. So be very mindful of the weight that you're putting. And in all cases, you can actually just cover your hand with a towel and then put the weight on top. Okay, so that's also fine, you can do. Mainly focus on putting the weight over your wrist area rather than your fingers first. Get your wrist a little bit more stretched out, then go to your fingers. If you want to get a full arm workout for all stages of stroke recovery for the entire arm, take a look at this video. Thank you, and I'll see you in the next one.